Yeah, good morning, everyone, and welcome to Ask the Pediatrician's Live. I am Bemi Salaboide, and it's a pleasure to be here this morning. This last week, we had two major days in the world. I mean, so we have the World Oral Health Day, and we also have the World Down Syndrome Day on the 21st of March. So it's been quite a week. And if you followed us on Ask the Pediatrician Foundation, we had our topics by our professionals on those two topics. And this morning, we're actually supposed to have ATP Live on Aura World about the Aura LD, and I'm supposed to have Dr. Bukelatos with me, but due to some circumstances, she's not able to join us this morning. But notwithstanding, we're still going to go ahead, and I'm going to be having your questions. So if you have any questions about the oral health of your children, and you also have any question about Down syndrome, I would like us to take those two topics this morning on Ask the Pediatrician Live. So you're all welcome this morning. So if you have any questions, you know the usual drill, drop your questions and comments. And if you're watching on our watch party, you can also drop your questions for me. And one of our moderators can help us bring it down to the live broadcast. Thank you so much. And no, I'm sure some of you be wondering how come we have so many of these oral health day. I mean, so many X days. And the reason why we have these health days is actually to promote awareness. If you know what Ask the Pediatrician stands for, that's basically what we do. We try to create awareness about important health issues. We want to work more on the prevention part of things rather than curative, because we know that prevention is really better than cure, as always. So if you been following us, so that's one of the reasons why we particularly likes to celebrate those 8 days, and we use it as an opportunity for us to feature, to encourage people to give you information about things that has to do with these health issues. And so this is one of the things we do on Aspecial Facebook group, and we're going to also be doing it on our HCP Live. So thank you so much for everyone who is joining me. I can see you all. So once again, if you have questions, we are focusing this morning on the Oral Health Day and Down Syndrome Day. So if you have any questions about any of these two major topics, you can share with us and we'll answer it. And even if you have any question on any other child health issues, I will take them as well. I'll just make it today as a bonus day to answer any questions anybody will have. Okay, so let's start by, let me talk about introduction and talk about basic things. Before, people used to think health is just about what the pediatricians do, is about physical health. And there are some aspects of health that people don't usually take as very important. And we talk about that's the oral health, and we also talk about mental health. But we're now realizing that these are also very important, even in children. And it's not important. It's important that we don't just talk about, oh, it's only when your eyes or your chest or the tummy is paining. But there's a lot to do with the mouth. In fact, the dentists like to say the mouth is the gaze or the mirror of the body. So there are some things that when we see in the mouth, it could tell us that there are some diseases going on in the body. So it's very important that we are very aware about oral health as well. So it is not only the physical or the other parts of the body, the health of the children are quite important. And so when it comes to children, I'm going to tell us about some basic recommendations that our dentists, our oral health professionals have made. Number one, we all know when it comes to children, we know about sitting, and I think we have talked about sitting so much. But what we want you to know is that, because mothers ask these questions a lot, is that you don't need to give teething powder to your children. Teething is something that happens physiologically. It's something that is normal, and so it's a normal developmental milestone. So there's no need for any medication. It's not a disease condition. It does not cause a disease condition. Now, from 6 to 7 months, your children begin to bring out their teeth. And parents do ask, when should I start brushing my teeth? Because they've heard, oh, this is just one tooth, or this is just two very tiny teeth. So the dentist recommend that once the child has brought out the first tooth, even if it's just one, that is when you should start brushing. So you should start brushing. And of course, for children at that age, they have what we got very soft toothbrush, not something too hard that will wear off the gums, something soft, but not cotton wool as well, because it won't be able to clean it properly. So dentists recommend that you should start using your toothbrushes even for once the baby have one tooth. You can start before that time. How do you clean the baby's mouth? Is to use water and a clean cloth to clean the mouth. So we don't recommend using things like glycerin, all those other things that are, most of them are very strong on the tongue of the children. So what is recommended is that you should use clean cloths, put into clean water and just clean the tongue and clean the gums. But once your baby has brought out their teeth, even if it's one tooth, just start using brush and toothpaste. And now when it comes to the toothpaste, we recommend that use fluoride containing toothpaste. Fluoride containing toothpaste, and there is a particular quantity that you have to use, because too much also can be bad. You should not use toothpaste that are not fluoride containing, but you should use fluoride containing toothpaste. Yes, I see somebody just know, as I'm just about to, as I started talking about that, somebody is asking me already, what is the issue about fluoride? Yeah, because fluoride prevents what we call dental caries. So it helps the teeth to be strong, and but at the same time we want it to be a not too much, because if it's too much it can cause what we call fluorosis, in which the teeth actually becomes, stained in a particular color, and it's not, so too much is also not good. But for the babies, there's what we call milk teeth toothpaste. Those milk teeth toothpaste have already have the right amount of fluoride for babies. So you should use those fluoride containing toothpaste, but appropriate for children. So whenever you go to the market to buy your toothpaste, please always check. If you're buying for yourself, just make sure you buy a fluoride containing toothpaste. Most of them have adult levels, but if you're buying for the children, you will likely have to buy something in the range of the milk toothpaste, because if they are cognizant of the amount of fluoride inside. I don't want us to go into figures, things that will get us confused, but just remember that milk toothpaste for children that contain fluoride, and for adults as well, fluoride containing toothpaste. Now, when it comes to quantity, I know that most of us will watch adverts, and when you see the adverts of the toothpaste advert, you see the person putting the toothpaste, they put it like a whole length of the toothbrush, and they even put a cuff at the end, and that is completely wrong. So the quantity of that toothpaste is too much, and so what the dentists have recommended is that use like a grain of rice toothpaste. A grain of rice, that is the quantity. And for the adults, you use a pea size or a granite size of toothpaste. So essentially, you actually need just very little toothpaste to keep oral health in children. And of course, the dentists recommend that you brush your teeth twice a day, in the morning after your breakfast and in the night before you go to bed. And this, we should try to instill these practices into the children quite early. And so we should start to do that quite early when the children are quite young. I know that most times the toddlers don't like to brush their teeth. The toddlers don't like to brush their teeth. They fight a lot, and that is not unusual. So most mothers also ask us that question a lot, like, oh, my baby doesn't like to brush teeth, how should I do it? You are not alone, you are not unusual. So that is perfectly normal for babies not to like to brush their teeth. But we are the ones that need to encourage them. And so how do you encourage them? There are many ways by which you can do this. And one of the ways by which we do it is to make sure when you want to make it fun, make it something like interesting. Don't make it like it's something that must be done. Just make it look like you're having fun. You can also buy toothbrushes that have very nice, maybe cartoon-like characters, those kind of things that children will be interested in using. And then when you're brushing teeth, you can also model. So you are brushing your own teeth, they are also brushing their own teeth. And sometimes for toddlers, it's better to have toothbrushes for the toddler. So the toddler is ready to brush at the same time. You as the parents, you have your own collection of the brush so that you can assist them. So you just assist them and just don't make it too like, these are some of these ways by which you can make it quite interesting for your toddlers to brush their teeth. And they don't need to brush for a 1 hour. It's just 2 minutes that they need to brush for. But when brushing, you need to make sure you brush it the right way. So you need to make sure that the dentist recommend vertical strokes. So you brush down, and make sure you cover all the face, and you brush up, and then you brush on the inner side up and down as well, and then you brush also on the surfaces as well, and then you also clean the tongue. Most people always forget the tongue as well. So you should do that for 2 minutes, and that should be fine, and you do it. And then finally, when it comes to recommendation, dentist recommends that you take your children to see the dentist on their first birthday. And I know most parents always ask, so some of them don't even have teeth yet, and they are wondering, oh, my baby hasn't cut their first tooth even at 1 year. Most parents are worried about that, and I always tell them, have you ever seen an adult without teeth before? So most children will eventually have teeth. Some have it a little bit earlier, some even have it from birth. But the average is from 6 to 7 months. That's when they begin to bring out the first set of what we call milk teeth, or temporary teeth, or primary dentition. And then after like 2 years, they should have had a complete set. Then they shed them again by 6 to 7 years, and then they begin to bring out what we call the permanent teeth. The first set of teeth, or temporary teeth, or milk dentition, usually about 20, and then the final, the secondary or the permanent teeth, about 32, which is what we all have as adults. So you don't need to worry, but the dentist recommend that by age 1, whether there's teeth or not, you should take your children for a dental check, and the first dental check, and after that, you should start seeing them every 6 months. So I've summarized to you what the dentist wants us to tell you about the oral health of children in the first, actually for us as pediatricians, what we need to know. And of course, if you have any issues, please do not waste time before you see your dentist. Okay, so I'll go on to answer some of the questions I have with me. Thank you, Onyi, for supporting me this morning by bringing questions from the watch party to the live program. Once again, today is we're taking ATP Live, talking about the 2 important World Health Days that we celebrated in this week that is ending today. So we celebrated the World Health Day and Oral Health Day, and we're also celebrating the World Down Syndrome Day. So I'll be taking topics about oral health, and I'll take topic about Down syndrome. So questions and comments about those 2 topics. I've already given a brief overview of oral health and what the dentists recommend for us, and we're going to I'll also now talk about Down syndrome as well. But before I go on to talk about a little bit more about Down syndrome, then I'm going to take some of the questions people are asking me about oral health. Thank you so much for joining me this morning on ATP Live. I am Bemisola Boyede. Okay, so Chidima is asking, Doctor, good morning, Chidima. Please, my 5-year boys know when they are sleeping. It's bright somehow. Okay, so I think a few weeks ago we took a topic on adenoid hypertrophy, and we have the pleasure of a consultant ENT surgeon taking the topic. So Chidima, when you finish ATP Live, go to ATP Facebook group, go through that topic. It's very, very important. So most children snore because of many reasons, but some snore out of habit. There's really nothing wrong. Maybe the tongue falls back and the posture and all that. But sometimes when they really snore and the breathing is somehow from what you are telling us, I think most likely a child may have what we call enlarged adenoids. Adenoids are like some what we call lymphoid tissue around the the airway, the entrance to the airway. And so when children are sleeping at night, because the tongue is also relaxed, falling backward, is there's a little bit of obstruction, and air is forcing its way through, and that's why they tend to snore and sometimes behave as if they're having difficulty taking in air. Now, the good news is that most children, the adenoids will shrink on its own by the time they're about 5 to 6 years. So most times the ENT surgeons just watch and wait and see whether it will resolve on its own. But if the condition is causing more problems for the child, like the child is having what we call sleep apnea, like the child will stop breathing in the middle of the night, or the child is really struggling, even in the daytime, the child is really struggling to breathe, sorry, or the child is having what we call infections of the tonsils and the adenoids, coming in and out of hospital for all those cough, catarrh, respiratory infection with fever, and the child needs to be treated with antibiotics so many times because of that. So if there are those complications, then the ENT surgeons will likely want to do an operation, which is to take out the adenoids. It's not it's a major operation, but it's a simple operation at the same time. So they can take it out, and that will be the solution. And so what we recommend is for you to see the ENT doctors first, so that they will evaluate your child and they will be able to know whether, oh, this is one of those cases where we can just watch and wait and see whether it will resolve, or whether this is one of those cases where we really need to do an operation. So I would recommend, since you're quite worried about your child, that you should take him to see the ENT surgeon for further evaluation. So Chidima, that's what I'm going to recommend for you to do. All right, so I'm trying to get my other questions out. Okay. All right. So let's move on. I saw your other questions where you told me the child is about 5 years. I think have sorted it out. Okay. Chinwe is asking, Doctor, my daughter 4 year old body odor. Have used lemon to wash her armpits and the odor is persisting. Now, it's a little bit difficult to know why the child has an odor. Number one, it's really not common at the age of 4 years for children to have odor. And sometimes I just want to be sure that this is not perception of the parent themselves, because some people are just so sensitive to everything. So I would recommend, if you think there's really an odor that you're worried about, then you may want to see a pediatrician, and sometimes you may want to see, they actually may decide whether you need to see a pediatric endocrinologist if it's really something we need to worry about. Usually, sometimes we just say use deodorants, but sometimes we just need to be sure that there's nothing else there for the child that is causing the odor. The odor may not even be from the armpit, it may be from somewhere else, and we just need to be sure where it's coming from and all that. Yeah. Okay. Thank you. And now Colabody is saying, please, how early can we correct a child's teeth position? Mine look like it's going to be out of the lips, especially the two up fronts. Okay. You didn't tell me the age of the child, because usually for children below 6, just in other words, basically for children who have primary teeth, they are going to share the teeth anyway. They are still going to have new permanent set of teeth. So there may be no reason to do anything for those ones. But if you are talking about an older child that is or an older child, then I would recommend that for the older child that you take them to see a dentist, of course. So the dentist, like I said, we are supposed to be seeing your dentist twice a year at least. So if you have seen your dentist twice a year, whether there's a problem or there's no problem, they will know what to do. And now that you even have a concern, then it shows that you really need to even see your dentist faster compared to somebody who doesn't have concern. But usually, I guess those kind of surgery will be done in children, or those kind of correction, sorry to say, will be done in children. Usually they use braces and things like that, will be done in children who are having their permanent teeth, and not just not just any child. Okay, thank you for joining me, everyone. Okay, let's see. C is asking, Doctor, good morning. Please, my baby of 7 months is having boil on her head, face, and neck. What can I use to stop it? Okay, so Essie, the first thing you need to do is to get your doctor to see you. Um, and treat these current boils. That's the first one, because usually boils are bacterial infection, and which suggests that the child will require antibiotics. And usually, you know us, we don't do that online, and we don't recommend you as a mother just going into any shop and buying antibiotics. We recommend that you see a doctor, get a proper prescription, because the antibiotic type and the quantity you give and the duration for which you give it is quite important. If you give antibiotics anyhow, it's even if your baby needs antibiotics but it's not the proper one, it is still antibiotic abuse, and that can be a major issue. So it is important that you see a doctor who will recommend the proper treatment first for this current boils. Now, when you finish treating the boil, the most important thing is the prevention. And how do you prevent this? Number one, hygiene is very important. Most of the boys are from staff, and most of the staff are from our ends. So you really need to wash your hands often. And this washing hands often is not only when you are going to toilet or out of toilet. Before you even carry your baby coming back from work, or coming back from you've gone to the market or anything, you need to wash your hands. Before you prepare food, you wash your hands. After finishing food, you wash your hands. When you change diaper, you wash your hands. Before you change diaper, you wash your hands. After changing diaper, you also wash your hands. These are all things that you need to do before we have to develop this habit of washing our hands frequently, even for the babies. Before you make their food, after making their food, you wash your hands. And you need to make sure that you wash your hands frequently. It's one of the most important way by which you can prevent infections in children. And apart from that, you also need to you can use antiseptics in your bath water. Sometimes some of us are not sure the kind of water that we're using is appropriate. And so these are some of the things which you can do to prevent recurrent infections. And of course, immune system, make sure your children eat well, make sure they take the immunization, and the general health promotion that we normally talk about. So these are some of the things which you can do to make sure that the children to prevent some of these infection. Okay, so I'm beginning to have so many questions now, so I'm going to be fast. Move on now to the next question. Dakas is asking, my 5-year-old daughter has lost her teeth last year, and they are not, just the patients, they are not yet growing back, and some others have got follow-up. There's no need for you to worry. The teeth will come back, because like I said, most children it's a range. It's like 5 to 7 years. So sometimes it may take up to a year for a new tooth to come back. So you don't need to worry about that. So you can just be patient. And again, remember to see your dentist twice a year. So most of us don't go to see our dentist. That's why. But if you have been seeing them regularly, then they'll be monitoring those things for you. And then the dentist recommend that if after 1 year of the anniversary of that tooth falling out, another tooth has not yet come up, then you should also see your dentist. So those are things you really need to do. But I think you should also be patient. All right, thank you. Shewin is asking, my 2-year-old son brought out only 4 teeth for a long time, and now no more teeth is coming. Should I be worried? No, you don't need to be worried. But then I would say again, see your dentist, because again, we recommend that you should see your dentist twice a year. So that is important. So you should see them, just for them to check, to know what because the dentists have a way of checking into the gums. They have the x-rays that they do, that they will help them to know whether the teeth are inside the gums, and why is it not coming up, the vitamin D deficiency or vitamin C, all those kind of things, the calcium deficiency. They will do all those checks for you, and then they will let you know what's next to do. Okay, yeah. So Enoch Alabado is saying baby is 7 years old, so you should see your dentist. That, because I am assuming the baby, the child has already brought out the permanent tooth, is because 5 to 7 is also the age where they start to change the teeth. So that has not really answered the question. You really need to know whether the child has at least the second set of teeth in that child, or are those the first set of teeth that are trying to come out? Because if they are the first set of teeth trying to come out, that's fine. Then you don't need to worry. But if they're the new ones that came out and you are worried about them, then you should see your dentist. Okay. All right, this is just general question. My baby's got a swelling but has not healed. It is discharging yellow fluid. That is pus. So when your baby's that yellow thing you're talking about is pus, and that shows that it is infected, and that is what we call omphalitis, like infection of the cord, and that requires umbilical cord infection. It requires proper treatment. It is not just it is not just penicillin ointment, and please don't use antibiotics anyhow in children, including even those that are being used as cream, because a baby could be allergic to penicillin. You give it to the child can react badly, and sometimes it could be life-threatening. So I don't recommend that. For this baby, you really need to see a pediatrician. Usually, most of us will give oral antibiotics, not even just the not just the ointment. We would definitely need to give oral, and depending on how bad it is. If it's so bad, because the cord in a baby is a straight it is straight to the heart and to the liver. It is a very important route, and infection in that area can easily spread even to the rest of the body. So we don't take it very lightly. We take it very serious. Sometimes we may even need to give the child IV intravenous antibiotics. Sometimes, depending on our judgment. For example, if I say a child with that kind of thing and the child is having fever, the child is very ill, not sucking and all that, I'm going to admit the baby, I'm going to put the child on IV antibiotics. But if it's a child who is otherwise well, but it's just no fever, nothing, then I would try oral antibiotics. So, and for a newborn baby, please see your pediatrician. Very, very important. And they will tell you how to also clean and treat that cord itself. The cord itself now needs to be cleaned with antiseptics, and usually we recommend chlorhexidine gel for it, and then you have to keep it dry. So it's very important. So for oh yeah, I think you really need to go take the baby this morning. As if you go now, even before the program ends, it's very important. Seriously, very, very important that you take the baby to see the pediatrician. Okay, so it is 9:30. Before I go on to take the next set of questions, I really want to talk a little bit about Down syndrome. Now, let me take out this question. Okay, thank you. Oh, yeah, please, your baby needs to see a pediatrician. I hope you heard me. Okay, so now let's talk about Down syndrome, which is the second World Health Day that we celebrated on the 23rd, World Down Syndrome Day. Now, people ask a lot of questions. Let me just say there are a lot of misconceptions people have about Down syndrome. People always think any child with disability is Down syndrome. Number one, that is wrong. So I saw a mom came to ask me on the open house on Down syndrome, or like my baby is having anemia, is having blood transfusion. Could it be Down syndrome? And I'm like, what has Down syndrome got to do with blood transfusion? I mean, that shows that people always think a baby who is not growing well, a baby who is having one disability or the other, then it is Down syndrome. That is complete misconception, complete misinformation. So Down syndrome is a genetic condition. In other words, a baby is born with it, and a baby is born with it. And basically what happened is that for those of us who still remember your biology, we all have 23 pairs of chromosomes. And then we now have our two sex chromosomes. So if you're a man, you have 23 pairs of chromosomes, and then you have an X and a Y sex chromosome. If you're a girl or a woman, you have 23 pairs of chromosomes. 23 pair means each chromosome 1 is 2, chromosome 2 is 2, chromosome 3, that is what we mean by a pair. So 46 chromosomes in all. So we have 23 pairs of chromosomes, and then if you're a woman, you have an XX sex chromosome. Now, what happens in Down syndrome? In a very simple language for everybody. I know that for those of us who are into the doctors, it's more technical than that, but I'm just going to make it simple. So basically what happened in Down syndrome is that they have, instead of 2 of chromosome 21, they have 3. So they have what we call trisomy 21. Trisomy 21 means in their normal body chromosome, that's what we call the autosomes, as against the sex chromosomes, they have three of the 21 chromosomes instead of having what we call, instead of having two of them. So that's why another name for Down syndrome is chromosome 20, trisomy 21. So I hope that is a little bit clear for those who are confused. Now, what happened is that for this, having this extra chromosome makes them prone to having certain challenges. So, number one, even so, there's a way we can know. So we can text them right in the womb, and from the womb we can know that this child has three chromosome 21. But when they're also born, there are ways they look, there are features we can see that help us to know that this child has chromosome 21, but that's not a problem. But the issue is that those who have Down syndrome are prone to having certain difficulties. Not all of them will have that certain difficulties. All of them will have the chromosome difference. All of them will have the Most of them will have the features, physical features, but it may be more obvious in others than in others. But most pediatricians will see a child with Down syndrome, and we will know that this child has Down syndrome just by the way the child look. The space between the eyes is a little bit wider. They have their eyes is the slant of the eyes is supposed to look straight. For them, it's a little bit upward. Their head may be a little bit flat. They may have only one single line instead of three that most of us have. So those are some of the ways by which we can know. And then they're a little bit floppy, what we call hypotonia. Though some of them may not have that as well. So, but what are the challenges? They have virtually all the organs of the body can have difficulties. So let's start it from the brain. Some of them may have difficulty with learning. In other words, they may have delay in their development, which is one of the reasons people worry, because it's one of the challenges that they have. Some of them may have, so they may be slow to see, slow to walk, slow to do everything, but most time they will eventually do that. But some of them may not always be slow as well. And then some of them may have heart problem. They may have holes in the heart. It may be a minor one that will close by itself. Sometimes a major one that requires surgery. They may have problem in the intestinal tract, we call the duodenal atresia, that requires surgery. And they may have problems with their thyroid gland. They may have low thyroid hormones. Not all of them. Some of them have so low that we have to give them thyroid hormone supplement. Some of them don't need it. So these are the challenges they may have, but not all the children have the challenges. Some have, some don't have. So because people wonder, is Down syndrome, how do we avoid it? Down syndrome is not a disease, it's just a condition. And people with Down syndrome can live normal lives. People with Down syndrome, they may have more difficulties, they may have more challenges than those who don't have Down syndrome, but they can see live their normal life. They can still be anything they want to be. So it is not like in some places they recommend that if you find out that you have Down syndrome child coming up, maybe you should terminate. But no, it is really not. That is really not right, because when you do that, like I saw in one of the flyers during this World Down Syndrome Day, that you are killing the happiest people on earth, because most people with Down syndrome are quite very happy. They're very cheerful, very beautiful, very smiley face and happy people. So the most important thing is to recognize a child with Down syndrome and to follow them up. That's what we pediatricians do, especially developmental pediatricians like myself. We follow them up, we monitor their health, so that if we pick up any of those difficulties, because we already know that they are prone to having these difficulties, we monitor them for those difficulties and we support them. So if their speech is slow, we send them for speech therapy. If they are slow with their walking, we send them for physiotherapy. If they are slow with so we support them. If we check their thyroid hormone, if it is slow, we give them thyroid function. We check their heart. If there's a hole in the heart, is it the one that will close by itself, or does it require surgery? We recommend them for surgery. So they will require they require many doctors, many specialists, many therapists taking care of them throughout their lifetime, but not everybody. So you've seen people who never have any of these issues, and we have seen people with Down syndrome who need to go to a special school, but we also seen those of them who went to normal school. So there's a lady in South Africa who actually have a degree and yes, she has Down syndrome. So it is not like a death sentence or anything. And so the World Down Syndrome societies are really pushing that we should support them, we should accept them. Yes, they're different from us. Yes, they may have more challenges, but that does not mean they are less human. So this World Down Syndrome Day is for us to acknowledge and to support those people who have Down syndrome. So I hope we all understand. So a child with disability does not mean a child, because especially those in Nigeria always think anybody with disability is Down syndrome or anything. No, 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 not at all. So I hope that has clear. Okay. So thank you so much for understanding and supporting and promoting love for those with Down syndrome. Now I'm going to go on with my next questions. Uh, Good morning, doctor. My husband who react to formula and is allergic to most baby food. What form of protein do you recommend that I give her that don't cause allergy? Number one, what is your child allergic to? Because that is what you really need to avoid. So, but this question is not really specific. Is it the cow protein that the child is allergic to? Is it the lactose? What is it that your child is allergic to? So that is what I need to know. So I would recommend that you see a pediatrician, preferably an allergist, so that we know specifically what your child is allergic to, and then we can recommend what you need to avoid. Because formula does not mean your child is allergic to protein. So baby food does not mean your child. Most baby food are not protein. Most of them are cereals. Most of them. So, and of course, some of them have other things added to them. So to answer your question, we need to know what is it your baby is specifically allergic to, because that is what we need to take out. And while on that, let me just say, when you want to give a child food, don't give multiple things at the same time. You give one thing at a time so that we will know. For example, if you give pap that is maize and the child react to it, then we know the child could be allergic to maize. If you give rice, the child react to it, we know. If you give fish, the child react to it. But if you give all of them together, then there's no way we will know which one your child is reacting to specifically. So you really need to go and give give breast milk. And if and make sure after give breast milk only. I hope your child is not allergic to breast milk. And then you can now, when you're introducing complementary food, where your child is 8 months old already, do it one food at a time. Don't give multiple food. Don't do baby food, because most baby food are a mix. Do something from your own kitchen and do it one at a time and all that. So for example, your baby is allergic to cow milk kind of milk, then you can go for things that are non like soya milk and things that are non-dairy, like that are not from cow. But we need to know specifically what the child is being allergic to before we can help. All right, how that is helpful. All right, so my time is going now, so I'm going to be very fast. Edwin is asking, how can we correct stammering in a child of 10 years old? No, so most children with stammering, there's something really, most of the time it's just anxiety, so we need to know how to help them. So, but the first thing you really want to make sure is that you don't put them under pressure. So somebody who's already stammering, you don't start saying, hurry up, say what you want to say. You're actually going to worsen it. Just be patient with them. Give them time to say what they want to say and encourage them. Tell them not to be worried, not to be nervous and all that. And then they will they'll get around it. So, but you can also see the speech therapists. They can also provide additional support. Oluwaseun, I'm not even sure I remember what your initial question was anymore, but I hope it has helped you to answer whatever question it says you have. Okay, let's move on quickly. All right, so I'm trying to. All right, Omolara is asking. Yeah, okay, so a child who was 4 years old, and then one of the teeth come out, and now it is not coming up again. It's lower, it has not grown to 9. Its lower teeth removed naturally, it has a green bar, but the upper one that removed prematurely. So you should really, when the child's teeth came off, you should have seen your dentist. That's what you should have done. I'm not so sure why you were not able to do that, because that's the right thing to do in the first instance, because the dentist needs to know. And I know there's a time Dr. Buki already told us that when the teeth came out, you should have taken it back to the dentist and they can even fix it back and all that. But so what you really need to do again is to see your dentist. I mean, it's almost like a recurring decimal. Some of the time I know we all as mother, we try to fix everything. We try not to avoid going to hospital, but there are some things that we can't fix and we really need to see the specialist to help us. So that's what I'll recommend for your Chris. Yeah, please kindly see the dentist as quickly as possible. Okay, so Deborah is asking, good morning. My son of 3 months has a swollen head, and I've used salt water. Please, should I be what? No, normally when a child, I don't know what causes swollen head. Number one, is it that the child eats his head and it became swollen? And I don't know. You need to let me know what is causing swelling. The child's head just starts swelling on his own. So that's why sometimes we find it difficult to answer some questions without asking a lot more questions. So, for example, if a child eats his head and it swells up, you shouldn't be using hot water. Let me tell you why. Because when a child eats his head, that's it is blood, it is the bleeding that is coming that causes that swelling. When you use hot water, you're actually making the blood vessel that is broken, that is causing the leaking of blood, you're actually causing it to bring out more blood. That's what you actually do. What you really need to do is actually the opposite. You need to put ice block. You need to put something cold on it, the cold compress, because what the cold compress will do is to shrink the blood vessel and stop the bleeding. So I know it's a cultural thing that once somebody's head is swell up, once anywhere swell up, hot water compress. No, hot water compress is more applicable to if something like a pus, like boil or things like that has pus, you want the pus to come out. But when somebody is bleeding and you want the bleeding to stop, hot water is the worst thing you can put on it. What you need to put on it is cold water, actually. So because I'm not sure which one is which in your own case, and usually once the after the swelling, definitely the blood will become congeal together, and it will become like a hard, because I'm trying to avoid using medical jargon, but basically the body converts it, into that surface, but the body will also remove it, it will remodel it. So if it's not paining the child, it's not red, it's not this, it's not that, it is not red, it's not hot and all those kind of things, just leave it alone. It will resolve by itself. Okay. All right. I think Enoch is trying to give me updates on the question I've answered before. Yeah, you're telling me that this is the permanent teeth. And you said after the first one was first reached the domestic accident is 7. And okay, all right. So you really need to go see your dentist, Enoch. I really think it's important at this stage to see your dentist, because they are the one that will really assist you further with that. Okay. All right. So please see your dentist as quickly as you can. Okay. I can see those of you thanking me for answering the questions. I'll not be able to feature that because I'm trying to finish answering those that are asking questions. Thank you, but I can see them. All right. Adedej is asking, good morning. Can autism be cured in a child that is undergoing therapy? Now, okay, so what's going to happen here? Adedej, World Autism Day is going to come up in April 2nd, and I will also be here to do a ATP live on what I hope so on autism. So don't worry about that. Number one, but let me just summarize by saying autism cannot be cured. That is the honest truth. Autism is a lifelong diagnosis, but people with autism can overcome their difficulties. Basically, that's what I'm saying. They can overcome their difficulties. So, a child with autism, maybe the child is not talking, the child can have speech therapy and learn to talk. The child is not very sociable, but the child can learn to interact. So, in other words, the child can learn to overcome the difficulties, and to a certain extent that even when you assess them again, you may not see some of those initial features that make you think that this child has autism, but we don't really say that the child has been cured of autism. So we always think the child is still have autism, because we always say once you have autism, you have it for life. But we can, people with autism can definitely overcome the difficulties with therapy. Okay. All right. Yes. Thank you so much. Shodwenka is asking me, my baby of 1 year old weigh 8.5 kg. She weigh 2.7. Yeah, no, your baby is fine. Normally, we expect the baby to weigh about 10 kilos at 1 year, but everything is average. So we have a range. So the range is 80 to 100, 120%. So in other words, some people will be the middle ground. Let's say the 100% is 10 kilos. So the baby who is weighing 8.5 is 85%. Anything that you see above 80 is still pass mark. Let me put it in that way. Maybe you understand it better. Another one, even though I want baby to be like 10 kilos, that is like 100%, but the baby will still weighing below, but anything above 8 kilos is still normal. Some baby will weigh like 12 kilos. It is also still close to number. So we worried about those who weigh like very below 80% or below 120% of what we expected. So in other words, a baby who is really underweight will weigh like below 80%, and a baby who is overweight will weigh above 120%. Those are the ones that we worry about. So your baby is fine. I don't think you need to worry. And more importantly than the weight, we're also interested in how the child is generally. Is the child very healthy, playing, developing well? So those are the other things that we worry about as pediatrician. So don't worry about that. All right. Okay, Esther is saying child care require a lot of patience. Yes, thank you. It's very true. That's very true. Most children require lots of patience to take them. And that's why you are there, because God knows you are the right person who can do this. And don't worry, you can do it. And we as pediatricians, we are here to support you all the way. All right. Okay. So yes, Cecilia is asking, at what age can a child start brushing at it? Is are you asking at the age we should start brushing, or when the child should start brushing independently? Because I just want to be sure which one you're asking, because before you joined us, or if you are just joining us, I've talked about the fact that from the first day that you can see the first tooth, you should start brushing teeth for babies. So from 6, 7 months, you start brushing it. But most toddlers cannot brush on their own because they won't do it properly. So you need to help them. So if you are talking about the baby brushing brushing his or her teeth independently, I would say maybe from 4 to 5 years old. Even then, you may still need to supervise them. In fact, some mothers tell me they still supervise their teenagers because they're not sure they're doing it properly. But basically, by the time they're about 4 or 5, we expect them to be a little more independent, but you may need to keep an eye on them. So maybe you want to clarify which one you're asking. See, for the children doing it independently, or for just doing it naturally. All right, Hajayobe, thank you so much for joining me. Time is going. So we're running up very soon. We have just 8 more minutes to go, and I still have some announcements for you. Okay, Doris is asking my good morning, Ma. Good morning, Doris. My son of 1 year and 11 months mostly bleeds when I'm washing his mouth. Oh yeah, because of this, using towels to wash his mouth. Anything to worry about? Now your baby should not be bleeding when you're washing his. And I'm worried because you said it's his son. I'm worried. I'll tell you 2 things I'm worried about. Number one, some people have what we call hemophilia, and that is a condition where they bleed easily. So we need to make sure that, and it's common in boys especially. So because when it says your son and it's always bleeding at that age, I'm worried about it. And I'll really recommend you see a pediatrician so that we can test the child. But I'm also thinking that it could be that you are using a very very hard toothbrush, because like I said, for children they need a soft milk teeth toothbrush, something soft. The tooth, even for adults, the dentist recommend that you use soft toothbrush. You don't have to. You are not trying to bleed the gum or to wash the gum. It's the teeth, and all you need to do is to clean all this. So soft brushes. So if you are using soft brush, the baby should not be bleeding. And unless the baby also have what we call gingivitis, and that is if there's inflammation around the gums. So two things. Number one that we need to rule out. Number one, make sure you are using a soft brush. That is the first thing. Make sure you're using a soft brush. Number one. Number two, make sure you're doing it gently. Number three, if your baby is still bleeding at that age, you need to see a dentist, and you also need to see a pediatrician. We need to make sure, because it's a boy, we really need to be sure that this child is not having those clotting problem issue, and that is a very, very important thing. Okay. Cecilia, I'll quickly answer your question because I've answered it before. Yes, once the baby starts bringing out their teeth, um, you should use toothpaste, and we already talked about that. You know what I recommend? Those of you that are just joining me, can you please watch the program from the beginning, because I've answered some of these questions. I've done all the introduction, and yeah, so oh my goodness. Cecilia is saying our son is already 1 year, 4 months, and I don't know when to start brushing the teeth. You should have started when the baby has the first tooth. You should have started when the baby has the first tooth at 6 months or 7 months. Once the baby bring out the very first set of teeth, even if it's one tooth, please start using brush and toothpaste. That's what dentists recommend. Use a soft toothbrush and a milk toothpaste. Okay. All right. Thank you. Children care is saying thank you, doctor, for answering my questions. Thank you. God bless you always. Thank you so much. I'm so grateful for you. My son is still vomiting. Okay, sorry. My son, Peter is asking, my son is still vomiting after 6 months of breastfeeding and always cries when it is eating. So let's watch. I don't know what's the question. Number one, your baby should not be vomiting anymore. Your baby should not be vomiting anymore at 6 months. So if the baby is vomiting, there may be a problem that we really need to deal with. And so I'll recommend that you should see your pediatrician to sort out that for you as quickly as possible. So the baby may have reflux, and it really needs to be sorted out quickly. All right, so I will not answer any more questions. So I will recommend that if you still have questions, you should you should post this on our Facebook group, and they will answer you as because of our time. So we're stopping in another 5 minutes, but I will just take those who have already dropped the questions for me already. But please, if you have questions after this, please post this on our Facebook group. All right. So Grace is asking, when will a Down syndrome baby start walking and crawling? It varies from children to children. There's no specific answer. Some children will walk on time. Some children will not walk on time. And for those who will not walk on time, we don't know when they will walk. We will just monitor them until they walk. And that's basically what we do. All right. Okay. So Innocent is asking, I know a child that is passing through adenoids in birth since 2 years, and doctor said the child can go through surgery, but as she's examining, the doctor gave them hope. Yeah. But she examined, the doctor gave them hope that their child will agree, but our worries is that it will destroy her sleeping. I don't understand what you mean by it will destroy. It will not destroy anything. The child is being monitored by the doctor, and the doctor thinks the child is not doing well. I mean, the child is doing well. So if the doctor thinks that, there's really no need for you to worry. If the mom thinks she's worried, then she can go and see an ENT surgeon or another surgeon for for further support. So that's what I recommend you do. Okay, fine. Now, well, what can I do for my older daughter? Tears kept coming down her eyes when she's out. I don't know what is causing the tears coming down for her. Is it that she's allergic? Is she reacting to something? So those are the things that we need to know. And after knowing that, they will be able to advise. Okay, how do we wash the tongue? I find it difficult to use brush. I use cotton wool and we fight, but she will hold the toothbrush herself. She's 1 year, 6 months. Yeah, thank you, Okweolu. We've already talked about it that toddlers don't like to brush their teeth. It's just they are just being toddlers. It's perfectly normal for them not to like it. And we've talked about tips that you can use. You need to model it. You need to make it fun, make it something interesting. And you give her a home brush. Yes, that is perfectly okay. You also have your own toothbrush, so you need to have like two, and then you just make it something interesting and all that. Eventually, they will get used to it. Okay. All right. So thank you everyone for joining me this morning. Thank you so much. It's been wonderful answering all your questions. And basically, for those who are joining us today, we've talked about World Down Syndrome Day, which we celebrated last week. And we also talk about the World Oral Health Day. And just to say that this program has come to you from Ask the Pediatrician Foundation. And for those of you who know us, we are always there to help to prevent child deaths. We want our children to live and not die. And ATP, beyond what we do on Facebook, we're also on doing in the community, doing community medical outreaches, and we would like you to really support us. There are many ways by which you can support us, and one of the ways by which you can support us is to give to us. We're a registered foundation in Nigeria, and we can see our account details there. You can give, if you're in Nigeria, you can give directly into our accounts, and the account details shown on your screen. Alternatively, you can also give to us on Global Giving. We are now a permanent member of Global Giving. Thank you to all those who supported our fundraising drive on Global Giving. I'm trying to look for that. So we thank you so much. So you can give to us on Global Giving, and we will always acknowledge your donation. And just know that anything you give to Ask the Pediatrician Foundation goes 100% goes back into supporting the children directly. We don't pay volunteers. I don't pay. I don't get paid for anything I do. So nobody gets paid for volunteering for ATP, but everything goes back into making sure that the Nigerian children live and they don't die. So you are always welcome. And we currently we just got an award yesterday, an active pediatrician. We are now one of the 100 awardees of the social media for social good awards in Africa, and we're so grateful for being recognized as one of those who are using the social media space to make good. And this is one of the things we do on ATP Live. We're using our social media platform to help and to ensure that the children in Africa, in Nigeria, do not die. So we appreciate your support. And if you still have questions on any other topic, just know that you can always ask your question on our Facebook group 24/6. We don't answer questions on Sundays, but from Monday to Saturdays we'll be there to answer all the questions that you may have. Just post it and one of us will address it as soon as we can. So once again, I really want to thank every one of you for joining me this morning. And I hope to see you once again very soon. The next World Health Day we'll be celebrating will be World Autism Day on the 2nd of April. And hopefully I'll be here as well to answer your questions about autism, and also on our Facebook group as well. So thank you so much for joining us this morning. And once again, we will appreciate your support, and you can give to us directly to our Facebook group, our Ask Virginia Foundation account, or you can also give to us on Global Giving. Thank you so much, and have a wonderful, wonderful weekend. Bye for now.